Next on Sisterhood of the Second Act.
As we age, our sleep patterns can change. Sometimes it can be harder to fall asleep, and we frequently wake up more often throughout the night. Kelly Link is a current member of the Virginia Academy of Sleep Medicine. She tells us why it may be more difficult to get a good night's sleep and what we can do to get more Z's. The road to good health starts at your mouth. Coming up, Dentist Caroline Wallace explains why good dental hygiene is instrumental in great overall health and how the prescriptions you take can impact what dental treatments you can receive. We'll meet both women on this edition of Sisterhood of the Second Act, right after this.
Sisterhood of the Second Act is brought to you by looking for your first home or retirement home? Realtor Monica Nicely can help you find it. Whether you're moving in or out of the Roanoke region, call Monica 540-449-2019, 540-449-2019. Alcova Mortgage Loan Officer Jonathan Sweat helps you seal the deal with a loan to suit your needs with great rates and terms. Call Jonathan 540-314-8843, 540-314-8843.
Alcova Mortgage, Equal Housing Lender, NMLS ID number 40508, MLSConsumerAccess.org. Terms and conditions apply. All loans subject to credit approval.
Step out the door with confidence, ready to conquer the day. Whether you are going to the cafe down the street or headed into work, you know you will always look your best in Cabby Styles. Your stylist, Darlene Marshall, will help you pick the styles that make you sparkle. And Cabby has styles for all body types. Call Darlene at 540-330-6819, 540-330-6819, and follow her on Instagram at Dapper Darlin.
I'm gonna be an oak tree.
I think I'll be a dogwood tree.
My kids say they be looking for a thorny tree from me.
With Evergreen, you can be a tree. Our biodegradable urn combines your ashes, natural soil additives, and a native tree of your choice. Be a tree and grow for tomorrow.
I want to be a tree.
Learn more at evergreenmemorialtrust.com.
Pat Lucas is committed to providing independent financial advice to help women and their families save money during this tax season. Call Pat at 540-798-8104, 540-798-8104. Securities and investment advisory services are offered solely through Equity Services Incorporated, member FINRA SIPC, 4401 Starkey Road, Roanoke, Virginia 24018, 540-989-4600. Now from the Fox Radio Roanoke studio, here's Kathy Heberly.
Welcome to Sisterhood of the Second Act. I'm Kathy Heberly. Is sleep eluding you? You are not alone. Between 10 and 30% of adults in the United States struggle with chronic insomnia, and the risk of insomnia in women is as much as 40% higher than men. Kelly Link is a board-certified nurse practitioner and a member of the Virginia Academy of Sleep. She is here to tell us more about the benefits of getting a good night's sleep and how to go about getting it. Thank you for coming in today.
Thank you for having me. I'm so excited to be here.
Well, we can't wait to learn more about this wonderful topic. So I guess we'll just start with, tell us about the Lewis Gale Sleep Center and what sleep disorders do you treat there?
Sure. So the Lewis Gale Sleep Center is a 3-bed sleep lab, and we also have home sleep study capabilities. We also do outpatient office visits, of course, to manage the sleep disorders. So the different sleep disorders that we treat include sleep apnea, insomnia, narcolepsy, sleep movement disorders such as like restless legs, and also like circadian rhythm disorders like shift work sleep disorders.
Sure. And then we mentioned the restless legs. I think we've all heard about that. Are there other ones that cause people physical, like sleepwalking? Are those still really things that can happen to people?
Yeah, sleepwalking, sleep talking, sleep eating. They're different parasomnias.
Yeah. Oh my goodness. I've heard of that, but I wanted to get your opinion on that.
Yeah.
So that's really, it's interesting. I think we're going to learn a lot of good things here today. What is a sleep study, and why don't you tell us who should get a sleep study?
Sure. So a sleep study is a diagnostic tool that monitors heart rate, oxygenation, breathing of the patient. The in-lab sleep studies, in addition, will monitor the sleep movement and behaviors, and also like the sleep architecture, so like the different stages of sleep as well. So people who should get the sleep study, people who are having issues getting to sleep, staying asleep, not feeling rested from their sleep, daytime sleepiness. Also, if your partner is noticing that you're snoring or even stop breathing in your sleep, that would be a good indication.
Definitely.
Right.
Yes, I think that's a very good one. And we are talking with nurse practitioner Kelly Link from the Lewis Gale Sleep Center. Is there a way to determine if sleep issues are related to medications or caffeine, for instance?
So with medications, always asking the prescribing provider about if that could impact your sleep would be recommended. Caffeine definitely can impact sleep, so we suggest no more than 2 cups a day, and not extending that past like 2 or 3 o'clock in the afternoon, because that can carry over into your sleep at night.
That makes sense. And also, I think probably one of the other things, I know, for example, I take several over-the-counters, medications and stuff. That should probably also be mentioned, I'm sure, when not just prescriptions. Is that correct? Can
Right.
some of those...
Yeah, definitely. You need to discuss that all with your provider.
Okay,
Yeah.
that makes sense to me, because we have, a lot of people that think, oh, I'm just taking, it's an over-the-counter, and, not thinking that it could impact their sleep is what I was thinking.
Yes, definitely.
Okay, so I think another thing that people would be anxious to know is, why is sleep so important to our health? We hear that all the time, and we know it sounds good, but why? Why is it so important?
So it's just like diet and exercise. That's how vital it is to our bodies. So we need that restore factor part of our body, so that way we can optimally function for the next day and for forever, right?
Right. Why do we have trouble sleeping as we age?
There's a variety of reasons for that. The biggest thing, as we age, there is a part in the brain that does regulate our circadian rhythm, which is regulating our sleep, wake, and drive cycles. So that does tend to deteriorate a little bit as we age. However, I find that patients, as they get older, especially as they retire, they're not keeping their same habits. So they're not keeping the same sleep time and wake time, which is very important for our circadian rhythm, and also getting enough sunlight during the day as well.
That makes sense. Don't you have a gland, the pineal? What's the gland called in your forehead that's supposed to help with your circadian rhythm? I think I've heard. Is it the pineal? Pineal gland?
There is the pineal gland.
Yeah,
melatonin
and it does have something, because I remember reading that as well. We are talking with nurse practitioner Kelly Link from the Lewis Gale Sleep Center. This is really good. You've already given us a lot of information. When does sleeplessness become insomnia? Are they two different things, and is one more serious than the other?
Sleeplessness is pretty much insomnia. So there's different types of insomnia, like initiation insomnia, so issues getting to sleep, and then also maintenance insomnia, so staying asleep is an issue. You can have one or the other, or you can have both. It just depends.
And that's one of the things you'll be testing for if people come to see you?
Also to make sure there's nothing else underlying that could be contributing to the insomnia issues, like a sleep breathing disorder.
Oh, yeah.
Can sometimes manifest as a insomnia too.
So do you wire people up to do the sleep studies?
Yeah.
Yes?
Yeah.
Oh, great. I know it doesn't hurt, so I just wondered how people can fall asleep with
right. Generally, they can do it because they're tired, or they make sure they're not sleepy enough to be able to fall asleep.
That's really nice. And when should we be concerned about our inability to sleep? Like, obviously, if you have a night here or there, right?
Right. So if it's consistent, if it's impacting your daily life, for sure. If it's like concentration issues, not able to perform your normal daily activities, that's when it should definitely be mentioned, especially if you're noticing other other medical issues, such as like high blood pressure. That can also be correlated together as well. So if you're not sleeping, it can help, it can increase your blood pressure.
I didn't know that.
Yeah.
So that it can have other long-term effects as well.
Right.
Okay, we are talking with nurse practitioner Kelly Link from the Lewis Gale Sleep Center. You're providing a lot of good information. Can you just run us through what happens when someone comes in for a sleep study?
Sure. So if they came into the sleep lab for an in-lab sleep study, they would come in at night around 8:30, 9 o'clock at night. And it's like a little hotel room, bed, TV, bathroom. They have electrodes on their head, airflow sensors at their nose, a pulse ox on their finger for the oxygen and heart rate, a heart monitor, 2 belts to watch their breathing, and then 2 limb leads to watch their legs. So they're kind of wired up.
Okay.
And then they
Well, it sounds like they'll get a lot of information out of one. This is a one-time thing
Right,
that they
yeah,
do it
one
for
night,
one night.
one night.
Wonderful. So when should we be concerned about our inability to sleep, and if we are worried about it, how do we reach out to a professional such as yourself?
So definitely, anytime that you feel like you're having issues sleeping, like again,
Yes.
getting to sleep, staying asleep, not rested, feeling tired, people noticing you snoring,
Yes.
you need to be checked out as well.
Okay.
That's when you should be definitely evaluated by a sleep provider.
Okay. And then how can we reach out? Do you have to have like a primary care doctor recommendation, or can we just call your
Yeah, you can call the office depending on the insurance. Yeah.
Oh, wonderful.
And
That
make an appointment. Yeah.
That's really nice way to get around all the other things. Are sleep disorders more prevalent now, or are we just more aware of them?
Yeah, I think we're just more aware of them. We're starting to realize how much it impacts our sleep. I mean, how it impacts our other medical issues. So primary care and then other specialists such as cardiology, they're doing a very good job at screening patients to see if they're having any possible sleep disorders because they know that it can affect their other medical issues as well.
So that's good. So you'll work together with them as well. I really like that. This sounds like a really great thing that you offered in our community here. And then I guess the last thing is, what can we do to improve our sleep quality?
So, practicing good sleep hygiene. So, sleep hygiene are things that you can do to improve your sleep to your best ability. So, again, like the caffeine limiting
Right.
that, no alcohol near bedtime or tobacco use.
That
Yeah,
would help.
yeah. Having that set bedtime, set wake time. Avoiding electronics at night or near bedtime.
I've heard that. This is
the
yeah, I'm
blue
glad you
light.
reminded us of that.
Yeah. And just having a good wind down period about an hour before bed so that way you're just not going full force from the day and trying to go straight to sleep. Having some wind down time is very important to help
That
you
makes
sleep.
sense. I know sometimes if I have the time, just taking a warm bath or something kind of just
to relax
to
you.
relax, yes.
Yeah.
So anyway, that all sounds like really, really good information. I'm very excited because I feel that a lot of people you're going to be getting a lot of calls. I think a lot
That's
of us are
great,
worried about
yeah.
our lack of sleep these days.
Thank you for having me.
Oh, it's been such a pleasure. We will have contact information for Kelly and the Lewis Gale Sleep Center in our show notes at sisterhoodofthesecond-act.com. When we return, another important way to maintain good health is to take care of your teeth. The link between good dental hygiene and a healthy body after the break.
Pat Lucas is committed to providing independent financial advice to help women and their families save money during this tax season. Call Pat at 540-798-8104, 540-798-8104. Securities and investment advisory services are offered solely through Equity Services Incorporated, member FINRA SIPC, 4401 Starkey Road, Roanoke, Virginia 24018, 540-989-4600. Looking for your first home or retirement home? Realtor Monica Nicely can help you find it. Whether you're moving in or out of the Roanoke region, call Monica 540-449-2019, 540-449-2019. Alcova Mortgage Loan Officer Jonathan Sweat helps you seal the deal with the loan to suit your needs with great rates and terms. Call Jonathan 540-314-8843, 540-314-8843.
Alcova Mortgage, Equal Housing Lender, NMLS ID number 40508, MLSConsumerAccess.org. Terms and conditions apply. All loans subject to credit approval.
I'm going to be an oak tree.
I think I'll be a dogwood tree.
My kids say they be looking for a thorny tree from me.
With Evergreen, you can be a tree. Our biodegradable urn combines your ashes, natural soil additives, and a native tree of your choice. Be a tree and grow for tomorrow.
I want to be a tree.
Learn more at evergreenmemorialtrust.com.
Once again from the Fox Radio Roanoke studio, here's Kathy Heberly.
Welcome back to Sisterhood of the Second Act. I'm Kathy Heberly. Dr. Caroline Wallace's practice, Complete Dental Care, strives to provide a stress-free environment where mutual respect between patients and caregivers can thrive. Your oral health impacts your whole body and is instrumental in the quality of your long-term health. Dr. Wallace is here to explain how oral hygiene affects our health and how the medications we can take can influence the types of treatments we can receive. Thank you so much for coming in today, Carol.
It's great to be here.
And a very pleasure to have you here. So our oral health impacts our overall health. What chronic illnesses, let's start with gum disease, are associated with gum disease?
Well, if you think about it, your mouth is the gateway to your body.
Yes.
So everything enters here, and there's a direct correlation between gum disease and hypertension and diabetes.
Oh my goodness, I didn't know that. That's not, for as common as those diseases are, it's not often talked about that way. How does that happen?
If you think about it, if you have any gingivitis in your mouth, if you have any bleeding, there are thousands of different types of bacteria in your mouth that are constantly being introduced into your bloodstream. Okay. That bacteria will go and stick around the tiny little vessels around your heart. As that bacteria goes through, it builds up over time, making the diameter of those vessels smaller, so your heart has to work harder to get the blood to flow through. And just keeping those gums healthy is the best thing you can do. With diabetes, that diabetes long-term plays havoc with the overall immune system. Yes. So there again, if your body's fighting the bacteria from gum disease, that's working on your immune system. So together, just trying to improve overall health. Keep the gums healthy, keep your body working less hard.
Thank you for being here, because that is something we always hear about, cholesterol and all these other things, and I have never heard anybody talk about dental health in association with blood pressure, and I know that that's a very common affliction in our country. So you've already done a great service to our community. I think the other thing people want to know about gum disease, we've heard that it can even impact pregnancies, and is that true?
It is. In Southwest Virginia, we have an issue with preterm low birth weight babies. We don't know exactly what causes labor, but we know that when a woman starts to labor, there's a huge increase in inflammatory factors.
I see.
So when you have active gum disease, you have an increase in inflammatory factors. So keeping the gums healthy will keep your inflammatory factors reduced and help you carry to a full-term pregnancy. Some medical insurance has recognized this connection, and they will even pay for gum disease services to be provided to the pregnant woman in order to try to prevent that preterm low birth weight baby and keep the baby out of the NICU.
Well, I'm so glad that they're recognizing that. That sounds extremely important. Can gum disease be reversed? Tell us about this.
There are different stages of gum disease.
Okay.
Type 1 gum disease, just general gingivitis, is bleeding of the gums that's not associated with any bone loss. That, with good brushing, flossing, you can reverse that. The way gum disease works is the bacteria get up underneath the gums and slowly eat away at the bone that holds the teeth in place. Once that bone is gone, it does not come back. That is irreversible bone damage, bone loss. So the goal there is to get healthy gums sitting on top of your remaining bone to help you preserve what you have.
All right. So that it still can help a little bit, and you should definitely
you want to hang on to what you have. Nothing beats the real thing.
That's correct. We are talking with dentist Caroline Wallace about how our oral health impacts the rest of our body. So if something is suspicious, what are the next steps?
At a dental exam, taking x-rays, we can see the amount of bone loss around the teeth.
Yes.
And then, of course, looking in the mouth, you can see if you have tight, pink, healthy gums or if there's inflammation taking place. So the step is to figure out at what level of gum disease you have and then treat accordingly. Gingivitis, is very treatable, very manageable. Most of us have some degree of it. But
yeah, I'll go in next. Go ahead, finish.
But as you progress through the different levels of gum disease, types 2 and 2 is just some general bone loss. That's typically pretty manageable with a good dedicated home care routine. But as you start to lose more bone around the teeth, in between the roots of the teeth, that is a much more complicated situation.
Okay, so most people our age would think they know how to take care of their oral health. What common mistakes do you see patients, with their daily hygiene routines?
Most of us don't brush long enough.
Okay.
We are supposed to brush for 2 minutes, but I can't remember the statistic. The average person brushes, it was either like 13 seconds or 21 seconds. 2 minutes is a really long time, but most people need to brush better and longer.
This question just popped in my head. What do you think of the sonic toothbrushes, the electric toothbrushes?
I'm a big fan of electric toothbrushes, particularly as we age.
Yes.
And we start to have dexterity issues. Our mouths get dry, the plaque sticks more. The electric toothbrush, that's mechanical stimulation, really helps to clean the teeth better than just a regular toothbrush.
And I find also, like, as you get arthritis and things, your arms are weaker, so you're probably not even putting as much pressure as you should. So they do seem to help with that as well. I know, I'm a big fan of
some of the newer toothbrushes will even tell you where you've brushed too long, too short, too hard, too soft, and that is a great tool for folks to use.
I'm getting that one next. Dentists are often the first line of defense in oral and throat cancer. And how do they identify these cancers?
During regular exams, we're looking for the funny lumps and bumps in patients, and fortunately we don't see that many, which is good. So oral cancer, looking in the mouth, there are different devices you can use that use fluorescent light to try to fluoresce any abnormal cells. Throat cancer is the tricky one because typically the patient self-diagnoses.
I see.
Once they become symptomatic, because we can't see down the throat.
Right.
And so unfortunately, once you have esophageal cancer, which is on the rise, that's a difficult diagnosis.
Is that also in relation to oral health, or is that other factors?
That's an interesting question because we see a lot more acid erosion of the teeth, and we think that a lot of the esophageal cancer is associated with a lot of acid reflux.
Okay.
So seeing the signs of acid erosion in the mouth for somebody that may not be aware of having any heartburn or acid reflux, if you can try to address diet, lifestyle changes.
Well, I know people drink too much soda.
Yes, they do. That's carbonic acid.
Yes, I know that. How long does it take to thoroughly, you mentioned 2 minutes, but how many times a day should you brush and floss? Just give us the general rule.
I mean, ideally, brushing at least twice a day.
Right.
Before you leave in the morning and before you go to bed at night for 2 minutes each time.
Okay.
Best to floss before you go to bed to remove the daily debris. But we always say it's what works in your lifestyle. And any time during the day is better than no time at all. And of course, if you're at home, you should brush after every meal. Some people consider that some nice diet control.
Actually, because then you don't want to eat again right away. So I totally agree and support that. We are talking with dentist Caroline Wallace about how our oral health impacts the rest of our body. A very important topic in my mind. And are women over 50 maybe starting to face osteoporosis? I know I am. I have it. And some osteoporosis treatments impact our oral health and potential treatments. Please explain what those medicines are and what impact they have.
Essentially, the osteoporosis medications work to harden the bone to protect you from fracture if you have a fall. And we see healing issues in the mouth, particularly with the lower jawbone, the mandible. If you can imagine, there's a decrease of circulation. That your bones, the bone marrow is spongy. So you decrease the circulation, it makes that marrow more like a hard sponge and firmer. But if you have to have any oral surgery and you're dealing with that bone, with that lack of circulation, we can have problems with healing. And a lot of these medications, some women take an injection once every 6 months. So that medication is really lingering in the body for quite some time.
And what about the ones that you take, say, weekly? Do they all, I mean, if you're on some form of treatment or supplement for osteoporosis, do they all do it?
There's risk associated with whatever you take.
Okay.
So it's if you're on any medication bisphosphonate for osteoporosis and need to have a dental procedure done, we coordinate with your physician. We have a phone call trying to figure out can you take a vacation from that medication to lower the levels and have an optimum time to maximize healing? Or if we're in an emergency situation, you have to do what you have to do and hope for the best.
So we're glad to be sharing this information. I don't think a lot of people are aware of it.
Unfortunately, no.
And
as we get older, we crack our teeth and people want implants, and that's not always an option.
I understand. And I know we've talked about insurance issues and everything. That's a whole nother story. We can have you back for some time. But you do have your own dental practice, Complete Dental Care in Salem, Virginia. You do take what we've kind of termed a holistic approach to your practice. Just give us, before we wrap up, tell us your practice philosophy.
We have a health-centered practice that the care is individualized to the patient and the patient's needs. Our philosophy is to help you keep your teeth for the rest of your life in maximum health, comfort, function, and appearance.
That is all we should be. So it's not just about appearance. That always makes you feel better if you have a nice smile, but the health behind it is equally as important.
They say the smile's the first thing people notice when they see you.
That's correct. So I would say, to wrap it up, that if you have problems, don't be afraid to go see your dentist, because that's the other thing that crops up.
And that we see a lot of that people wait until there's a problem and then it's a bad experience versus prevention. I feel like Ben Franklin.
Yes.
An ounce of prevention is worth a pound of cure, and maintaining regular appointments and exams and catching problems when they're smaller are much easier to take care of.
And you should see your dentist twice a year.
At least
twice a year. Okay. Well, thank you so much for joining us today.
Thank you.
It has been a pleasure having you, and thank you for sharing some very valuable information that not everybody is aware of. And I really think that the importance of dental health needs to be stressed a little bit more. So thank you for joining us.
Thank you for having me.
It's been my pleasure. We will have Caroline's contact information in our show notes at sisterhoodofthesecond-act.com. We'll be back to wrap up the show after this.
Kathy's wardrobe provided by Cabby stylist Darlene Marshall. See the styles in our show notes at sisterhoodofthesecond-act.com.
In a region known for its beautiful mountain surroundings, our vibrant arts community makes the Allegheny Highlands a more colorful place to live and visit. Our passion for the arts is endless, and it's uniquely Allegheny.
I want to thank Kelly Link and Caroline Wallace for joining us today. From Kelly, we learned the importance of sleep and where you can go if you need help getting a good night's rest. Caroline told us how oral hygiene impacts our health and how the medications we take can influence what types of treatment we can receive. I'm Kathy Heberly. Join us next week for another edition of Sisterhood of the Second Act.